Welcome to the Where Can I Find Additional Training for Infection Prevention and Control conference call. My name is Jenny and I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star then 1 on your touch-tone phone. I will now turn the call over to Diane Dohm. You may begin.
Good afternoon, everyone. This is Tony Kettner with the Lake Superior Quality Innovation Network, or Lake Superior QUIN. The Lake Superior QUIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. I'd like to welcome you today to call number 5 of our Introduction to Infection Prevention and Control Open Call Series, Common Citations, What Are We Missing? It's my pleasure to introduce today's speaker, Diane Dohm. Diane is a nursing home project specialist with Medistar Incorporated and currently assisting Wisconsin long-term care facilities with enrollment in the National Healthcare Safety Network, reduction of C. difficile infections, antibiotic stewardship, and infection prevention and control. Diane is a certified medical laboratory technologist, has a bachelor's degree in business, and has been board certified in infection prevention and control since 2008. Diane is also a certified professional in healthcare quality. Diane, I'll turn the call over to you.
Thank you, Tony. Just to clarify, today is actually call 6. So where can I find additional training for infection prevention and control? So sorry about our little introduction from last session. So thank you for joining us today. We hope you found the series of calls helpful. Just a reminder that all calls and slides will be available on our website, within a few weeks after the call, and that's the lsqin.org website. So as I said, we are on call number 6 today. We do not intend for these calls to be a substitute for the requirement for completing specialized training as in Phase 3 of the final rule, but we are going to talk about that today as we finally have gotten some new information regarding those regulations. You can ask your questions in chat during the call. We'll also open up the call at the end for you to be able to call in through the operator with questions. After this webinar is over, all the questions and answers will be compiled into a total Q&A for the entire 6-call series and then be available on our website as well. So today's objectives, we're going to talk about sort of currently the processes for education that are out there, evaluate local, state, and national opportunities, and talk a little bit about prioritizing some of those potential opportunities. We'll also be reviewing the CMS and other training opportunities that are available. So when you think back to how you started in your role as infection prevention, you might have volunteered for it or been assigned the role, probably one of many hats that you wear. You likely inherited a process of surveillance from the previous person. That previous IP may or may not still have been at the facility when you took over. And a lot of infection prevention and control is really learned on the job. In the past, there's not really been a lot of long-term care specific training to infection prevention and control, but we are going to talk today about some specific trainings that will be coming out. So we'll start off with a review of the conditions of participation, which you know is the final rule, the infection prevention portion of that rule. So as you know, in Phase 1, which was to be in place by November 28th of 2016, required you to have an infection prevention and control program, along with written standards, policies, and procedures. Phase 2, which was required to be in place by November 28th of last year, required you, in addition to the first phase, to have now an annual facility assessment. We've talked about that facility assessment driving your infection control program, and also to have an antibiotic stewardship program. So you should have already done your facility assessment, and you should have a good start now on your antibiotic stewardship program. What we're going to talk a little bit about today is the Phase 3 rules, which do not go into effect until November 28th of 2019. And although that sounds like a long ways away, I would suggest you don't wait till in November of next year to really start looking at this, because these requirements are going to take a little bit more time to put in place, which is why CMS gave us until 2019 to have them done. So part of that Phase 3 rule states the facility must designate one or more individuals as the infection preventionists, and they are responsible for the facility infection prevention and control program. That infection preventionist, or IP, as far as background, needs to have primary professional training in nursing, medical technology, microbiology, epidemiology, or another related field. They are to be qualified by education, training, experience, or certification. They are also required to work at least part-time at the facility and have completed specialized training in infection prevention and control. The individual designated as the IP must also be a member of the facility's Quality Assessment and Assurance Committee and report on the Infection Prevention and Control Program on a regular basis. So again, it emphasizes that the infection preventionist is part of that team. Infection prevention and control is everybody's responsibility and does need support of administration. So CMS did come out in March 16th of this year with some information on what that specialized training is going to entail. So the Centers for Medicare and Medicaid and the Centers for Disease Control and Prevention, their statement was that they recognize that providing specialized infection prevention and control training for long-term care and nursing home staff can lead to increased health benefits to nursing home residents. They will have a specialized training course that is under development currently. They're collaborating on the development of that course that will be free of charge, will be online-based, so you'll be able to access it on demand. Their projected release date is spring of 2019. They estimate that it will take approximately 20 hours to complete, and you will be provided with a certificate of completion upon the finish of that course. So they are making it very accessible, and this will help us to comply with the requirement for training. Other than the fact that you do have to find the 20 hours in order to complete the program, and I know for a lot of you that's going to be a challenge. But it is going to be at least free of charge, online, and on demand. So some of the content in that program, they're going to encompass many of the topics that we've discussed in our call series. Infection prevention and control program review. What are the responsibilities of the infection preventionist? Your requirement to be part of the Quality Assessment and Assurance Committee. They'll talk about surveillance and outbreaks, as we have talked about on our calls. They'll review hand hygiene, the principles of standard and transmission-based precautions, medication and sharp safety, respiratory etiquette, device and wound management, also environmental cleaning, disinfection, and sterilization. And a lot of these elements will be covered by your critical element pathways, so that's a good time to pull those out as well and look at those. In addition, the content will include vaccine preventable respiratory infections as well as tuberculosis, employee and occupational health, linen management, water management, antibiotic stewardship, care transitions. It's going to be a pretty extensive amount of knowledge to be covering in those 20 hours that they're estimating that it's going to take you. Because it is so accessible and it will be free, I think it would really be helpful for you to start thinking about the fact that more than just the infection preventionists could really go through this training. Thinking about having more members of your leadership, whether it's your director of nursing or the assistant DON, charge nurses, others who just have a passion and are interested in infection control. I think that it will help them be more aware of the science behind the best practices and the elements that you've been teaching for infection control, this way that they can understand what's really behind all those things that we've been asking them to do. And hopefully it will make them much more supportive of infection prevention practices. So I would really encourage you to start thinking about how can you utilize that training for more of your staff than just the infection preventionist. So spring 2019 is their projected release date. It's really quite a long time away yet. You likely will have a survey sometime between now and then. Perhaps you'll have a new infection preventionist, and that new infection preventionist certainly cannot wait over a year for any kind of training. So you really want to watch for offerings from all your stakeholders and participate in all the programs now as you're able. So we're going to talk a little bit today about really what is out there and what you might be able to utilize for training. Checking the CDC website, they have many great webinars and information on their website. The Division of Public Health and the Division of Quality Assurance in each of our 3 states usually puts on some information throughout the year, and I'll have some in the remaining slides where we'll talk about some specific things that they have coming out. The professional trade organizations that you might belong to certainly provide a lot of education during the year, as well as the Lake Superior Quality Innovation Network that we're a part of. And you really want to make sure you're utilizing those trainings and keeping your certificates of attendance for anything that you attend, so that as you're being asked to show your training for infection prevention until that CMS program comes out, these are the types of things that you can start to show the surveyors that walk into your building and ask for that information. One of the professional organizations that you can also look to is APIC, APIC, Association for Professionals in Infection Control and Epidemiology. They provide online training, including free, live, and archived websites on various aspects of clinical information related to infection prevention, the regulations, and best practices. They do have a listserv specific to long-term care where you can pose a question and get answers from your peers, especially helpful if you're looking for a sample policy to start with. You're still going to want to evaluate anything that you take off of that listserv, make sure it's applicable to your facility, make sure it's applicable to the current standards, but it often gives you a place to start so that you're not reinventing it. They have an infection preventionist guide to long-term care, and I'll have that link in the resources at the end. This is a book that just talks about a lot of the things that we've covered in our webinar series, the basics of infection prevention and how it relates to the long-term care setting. They also have national, state, and local meetings. In your local chapters or your state chapters, they usually provide education at each meeting along with networking time for your peers. There's a fee to join National APIC. It's just under $200 currently, and then a small fee of $10 to $15 to join the local chapter. They do have national courses that you can take as well. They have one coming up, and this is called EPI, or Epidemiology 101 for long-term care. This is just a listing of what they're going to cover there. APIC courses are great. They're very inclusive in their information, but they can be expensive. This particular course runs $850 plus travel time. And often, if you took this as your first training, would tend to be a little overwhelming. Usually, a course like EPI 101 is better if you've been in the field for a while so that you understand the basics and then can really build on that knowledge. Their next offering for long-term care will be in October of this year in Michigan, so I have that information there as well. Each of the 3 states, Michigan, Minnesota, and Wisconsin, that make up the LS, the Lake Superior Quality Innovation Network, are also offering programs. So the Michigan Department of Health and Human Services is providing an APIC infection prevention and long-term care certificate program. It's a 2-part program that will be offered at 2 locations. It will be free of charge, and the registration materials should be available soon for that. And there is a link there on the slide so that you can watch for that information. So just a caveat that these state trainings will likely not qualify for CMS's specific training that's going to be required, but they're a great start to bridge that gap for education until that course is released in spring of 2019. Minnesota has a more extensive APIC certificate course. This one covers all healthcare settings. It's not specific to long-term care. And you can see the contact information and the cost, et cetera, there. This one does have a requirement. You have to have access to the APIC text. The APIC text is a very inclusive, it used to be published as a book, and now it's an online version of the manual that has information on all infection prevention topics covering all areas of healthcare, not just long-term care. Wisconsin will be offering a course this fall. Wisconsin Hospital Association, Division of Public Health, and MediStar are collaborating to provide a boot camp in fall of this year. It is tentatively scheduled for September of 2018. The first offering will likely be in the Pewaukee area, and then the hope is that it will be repeated in other parts of the state. This will be a one-day with a very minimal fee, probably to cover the food for lunch. You'll end up with a certificate. This one will cover all healthcare settings, but have specific long-term care breakouts, and you should see more information available about that shortly. So, as I said, all 3 states are offering opportunities to participate in education prior to the release of the CMS program that will be coming out in 2019. Some of the resources that we've talked about today, the critical element pathways that you've heard about. So these are readily available to you. The link is on the slide there. There are actually 41 total pathways. This is the link specifically for the one for infection prevention, control, and immunization. So this is really, if you will, the blueprint that you can use to prepare yourselves for a survey, to do an evaluation of your program, find opportunities for improvement, be able to fix those issues prior to the surveyors even coming to your facility. So it really should not be a surprise what the surveyors are looking at when they come into your facility, because they follow this pathway as well. I mentioned the Infection Preventionist Guide to Long-Term Care. This was published in 2013, and we have a link to it here. This resource can be purchased whether you're a member of APIC or not. It's around $100. You can actually get it off of Amazon as well as APIC. It is just really a good overall review of infection prevention, specific to long-term care. It has samples of audit forms, et cetera, and policies in there that you might need. So with that, we talked today a little bit about the training that is to come and what is available now. If you have any questions, now is the time to ask them. You can put them in the chat box as well. And then we'll have the operator give us information on how to call in with a question.
Thank you. We will now begin the question and answer session. If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. There will be a delay before the first question is announced. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touch-tone phone.
Also listed on the slide is the link for evaluation for today's call. Once you complete that evaluation, you will receive the link to your certificate of attendance so that you can print that for your records. So as we're waiting for any calls to come in, I'm going to just look at the chat box here. There are a couple questions there. So there is some information in the chat box about the 2-part APIC course and how to pre-register. You do need to be an APIC member to take that course for free. Another question, what are the advantages of joining a local chapter? I really think that joining a local chapter is one of the most important things that you can do. This is where you can network with your peers. You can bring your concerns, your problems that you might be having to that group and discuss how other like nursing homes in your area have solved that issue. Again, they are very good about sharing policies. If there's something that you need a policy for that you don't have, somebody will provide you with one to use as a basis. Again, always remember any policy that you're getting in, you want to evaluate that policy, make it relevant to your facility. You don't just take it and put your name on the letterhead, but you really have to make sure that not only is it relevant to your facility, but then that you've trained your staff on that policy. But I really feel that the networking opportunities from joining a local chapter is a big part of what can give a new IP or a struggling IP certainly a lot of help and support. Any other questions that we might have today? After today's call, I'll be also putting all the questions that we've had from calls 1 through 6 together into a Q&A document that will be on our website. You've all asked some wonderful questions, and I'm sure typically if one person has a question, somebody else has the same question, and that's why we put together the Q&A document. So look forward to that coming as well.
And we have a question from Faye Diet.
Yeah, I just had a question about how to print out I never really had a link or password for the programs, so I never got to print out any of the end sheets for education.
For the certificates after you listen to a broadcast, if you pop me an email, I can get you the link for those certificates.
Okay.
Just tell me which calls that you listen to, and we'll get those to you.
Oh, okay. Sounds good.
Thank you.
As a reminder, if you have a question, please press star then 1 on your touch-tone phone.
So there's a few questions in the chat box about the training in Michigan. So I would suggest that you contact through that link provided there and see if you, one of the questions is, can residents from other states go to that training? I don't really have the answer to that. It may depend on the volume of people that they get signing up. They may prioritize their folks in Michigan first and then open it up. And the website has 2 different sets of dates, so that may be that they're offering it 2 different times. But again, those details should be on that website. In the chat box, again, is the link to the 2-part APIC course that was previously put into the chat box in case you weren't able to see that. So again, just kind of in summary, we've really talked about looking at what's available from your partners in healthcare. What is your Division of Public Health or Division of Quality Assurance? What are they offering for education? In Wisconsin, there's a very active DON council. So there are a lot of opportunities for education. Look at what your professional organizations may be offering, as well as the LSQIN, Lake Superior Quality Innovation Network. Look into APIC as a resource. And one question does come up, I think, more so before the CMS finally did put out some information on whether you were going to have to be APIC certified in order to work as an infection preventionist in long-term care. And really, I don't see that that's going to be a requirement. I've seen nothing in print about that. At this point, an APIC certification is based on training for all healthcare settings. It is not specific to long-term care. And I think really the biggest advantage to the CMS program that's coming out is it will be specific to long-term care. So you won't have to learn about surgery centers, and you won't have to learn about things that you don't necessarily come into contact with. Being certified through APIC is certainly an admirable thing to do. It will certainly further your education preparing for that certification, but as of now it will not, in any writings that I've seen, be a requirement. Just a reminder to complete the evaluation for today's call. Once you do that, it will prompt certificate of attendance. When you close out of today's call, you will also be able to get the link for that certificate of attendance. So the question in the chat box, this entire course available for review, and I'm not sure if you are intending for the APIC course. You can check that on their website. They'll have information on what's included in their programs, depending on which state that you're looking at. As far as the entire series of calls that we've presented here in the last 3 months, I guess, those PowerPoints as well as the recordings will be on the Lake Superior Quinn website. There's a note in the chat box as well that for Michigan, they will be offering APIC membership, so national membership, as a perk for those folks to sign up for their program. So I will be trying to find out a little bit more information about that program and see if it is restricted just to members of Michigan, and I can put that into the Q&As as well. So we'll try and put, there it is, your evaluation link in the chat box so that you can click on that. So if you've been able to listen to all the calls in this series, I would be interested in your feedback as well. You can just send any comments to my email address there. What did you find helpful? What did you hope you would have learned more about that maybe we weren't able to cover? So we really would like to know what is it that you're still looking for information and education on that will help us guide our education efforts going forward. Excuse me. So feel free to drop me an email and let me know what it is that you liked about our program, what you think we can cover in another venue, if possible, and let me know what you still need for education. As you have heard and as you know from working in the field, infection prevention is a pretty broad topic to try and cover in the minimal time that we had. So we really tried to pick some of the highlights to give you a start on education and give you some good resources that you can go to for more information as well. Do we have any more questions today?
We have no phone questions at this time.
Thank you. So with that, it ends our 6-part series. We hope that you have enjoyed it. We hope that you have found it helpful. And again, we are interested in your feedback. So please let us know what you thought of the program and what you would like us to get more information on out there. You can always pop a question to, excuse me, to my email as it's listed there. The evaluation link has been placed in the chat box again. It also should appear as you close out of today's webinar. As you close your screen, that should pop up as well. So again, thank you for attending, and that concludes our series.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.